What sets surgery apart is that we're able to take a patient who's sick and in 2-3 hours make them better. There's no other field that's like that. I don't have to wait for antibiotics or another medication to work. I'm able to make them better immediately. And I've always loved the technical aspects and working with my hands and things like that too. So surgery was the right answer for me. I do general surgery, which means that I operate on the gallbladder, the appendix, most abdominal organs, as well as lumps, bumps, hernias, typical things of that nature. I really enjoy robotic surgery. I think robotic gallbladder removal and robotic hernias are some of my favorites. I recognize that, in my opinion at least, everything in medicine should be shared decision making, right? So when a patient comes to me and says, I'm really nervous about XYZ part of this, maybe it's the anesthesia, maybe it's the risk of a certain complication, the best thing I can do is to share my knowledge of the likelihood of that complication happening or what we can do to avoid it. I think there's definitely been a trend towards minimally invasive surgery, particularly robotic surgery in the past 5 to 10 years. My residency did a very good job of making sure that there was a program in place to get people trained. And I think that it's really going to keep moving forward in terms of moving from right now multiple port robotic surgery to single port robotic surgery. I really think that's the future of where surgery is going. One of my favorite parts about working here is the camaraderie between my senior partners and myself. We're able to talk through any issues, any questions. One of my more senior partners, Dr. Sadowitz, is right at the forefront of robotic surgery. So having those leaders in surgery right behind me, having my back day in, day out is really helpful in terms of we're all able to move forward together. Everyone who works here is in itself part of its own community. There's a built-in feeling of coming home when you come to work, which is really nice. I think that it's frequently overlooked to find a position where you have people that you enjoy working with. You go home happy, you come to work happy. And when everyone that you work with and you yourself are happier and healthier because of it, the patient actually gets better care. Because when we show up for ourselves, we can show up better for our patients. I found that here at Krause.